For the past 2 years, the Fraser Coast community has been working on the Fraser Coast Community Social Plan with the Hervey Bay Neighbourhood Centre and the Fraser Coast Regional Council. This was provided through funding under the Australian Government's Building Better Regions program. Tonight you're going to hear from 8 of our key themes under natural environment, which is livability, diverse communities, community health, the ageing community, families and children, youth, the cost of living and affordable housing. The actions and strategies that have been developed to improve the wellbeing of the Fraser Coast have had 4 key objectives. This included understanding our local data, which meant we had to develop baseline reports to ensure our community understood where we are currently at. Secondly, improving the navigation of our services. So creating pathways between each of the services that are already existing to ensure smooth pathways for clients in need. Investing in social innovation. This included running a number of pitch nights and delivering professional development across the Fraser Coast. And lastly, creating evidence-based monitoring and evaluation. So ensuring the projects we delivered were measured and evaluated to check that they're actually doing what we hope they should be improving. So a special thank you goes to Fraser Coast councillors Zane O'Keefe, Darren Everard, David Lewis, Anne Madden and Dennis Chapman for their financial support to implement the Fraser Coast Social Plan. As I mentioned tonight, you'll hear from the 8 team members who have been helping oversee the key projects across many of these services. This included, as I mentioned, the baseline reports. So we have looked at delivering multiple surveys across the community, which included the youth survey. That survey was in partnership with the local high schools and the Reconnect Youth Service, which had 5,000 young people complete the surveys to help us better understand their needs and the homelessness issues they're currently facing. Other projects will include the update on where the actions and strategies are at. This includes some of the council's initiatives regarding the community library, so the little blue book, the little lime book, and of course the little black book, which is in partnership with Fraser Coast Mates. The first pitch night, which was held in Maryborough in February, they will also touch on some of those key projects and initiatives that were first launched and are now successfully being delivered in our community. The winners from that night included the Youth Street team and the Youth Centre, and also Steam Festa as the Community Choice Award. Other pitches included the Red Tape Shredders, who have recently held their first Bay's Biggest Sleep Out and successfully raised over $15,000. The Kindness Crew, who are about to host in November the first World Kindness Day event. And of course Bite the Blue, Jess, who proposed a social connection program and has now trained over a dozen ambassadors in our community, and her business is now in a lot of our local cafes and businesses, including down in Victoria. So as mentioned above, we'll also be ensuring that these projects are measured for social impact. This included one of our projects with Red Cross, Youth Mentoring and Queensland Health with local primary schools. They delivered the Read Bears project to successfully improve the reading for our Year 1 students. So the updates from the 8 themes are only 5 minutes, and they cannot possibly capture all the wonderful work that our community has been delivering, including our organisations and businesses that are dedicated to improving our community. So please keep that in mind as you're watching these, and if you do have any updates, please let us know. If you would like to be involved, please contact Kate at the Hervey Bay Neighbourhood Centre, and if you would like to put forward an idea and participate in our pitch night in November, please let us know. We'd be really happy to hear your idea and help get it up and going in our community.
I'm talking about the social housing plan. Imagine tonight a storm hits your house. The roof is gone, hail damage rips through your house. You run out to the car, you sleep, spend a rough night in your car. You wake up next morning and you think, we cannot return to this. It'll be months before it's repaired. So you could stay with family and you could stay with friends. You might even be able to rent a motel. How long can you do that for? You might have a caravan, great place for a holiday, but how about spending months, maybe even years in your caravan? You realise you need to rent. When you go looking for that rental, you're going to find it very difficult to find rentals in Hervey Bay, Maryborough and Bundaberg. So I want to talk about social housing, distinct from affordable housing. We have a problem in Australia. Across the board, 10 years ago, we needed an extra 100,000. Here we are today, 10 years later, we're up to 250,000 houses short. And the problem's not getting better, but worse. So housing is a real issue for our community. Back in the 1800s, average house was about 3 bedrooms. Today, it's 6 times that size. And yet we have more than half the people living in those houses in terms of numbers. Bigger houses, less people living in them. There is a problem that we need to solve around housing. Part of the issue, and there are 3 things I want to talk about, are first of all, the client group we often work with for social housing. They are overrepresented in terms of mental illness, also in terms of their education. The number that complete high school is limited, and that impacts them in a number of different ways, such as their education, therefore their employment, and therefore their ability to be able to afford rent. There are other issues in terms of substance abuse. We also see issues around domestic violence, and along with that, a number of other social issues. Things like hoarding, the ability to maintain a property effectively so that they satisfy the landlord. So that's a challenge, and we need to do work in that space to help people. We also have issues around investing in properties. There's not the incentive to invest in properties because the return on investment is perhaps not what people really want in the market. Then there's the issue of properties themselves being damaged and people then having to deal with that issue. There's the willingness of the market to take in people from the sector where social housing is required. There's a broader empathy of the community that perhaps trying to understand why people struggle within that space. The other area that we also struggle with are things like legislation that allow alternate forms of housing. We have issues of the affordability of a house and for people having to move out of areas away from their social supports. So you can see that there's a number of challenges about being able to deliver housing. So moving forward, what are some of the solutions? What are some of the things that we're doing to address the housing issue? One of those things is that we need to take a housing first approach. That is, we need to make it a priority to get people into housing first. Those countries and cities that successfully addressed homelessness have made this a priority. The second area that we're dealing with is around the fact that we need good data to understand the issue currently so we can respond appropriately. We also need innovation. We need to think outside the box, and so that includes changing our legislation to address some of the issues to do with housing, the size of housing, perhaps even the notion of tiny houses being placed on properties that are able to take more buildings. Also, the idea of housing itself, who you live with. So we have in the past addressed the issue of older people, especially older women, being able to be connected up with other women and sharing properties together. And that has been a solution in the past, that needs to be rejuvenated. The other area of innovation, such as in Holland, where younger people, say university students, are matched up with older people, and that allows them to be able to get, for the university student, cheaper rent, the young person, cheaper rent, but at the same time dealing with an issue of loneliness and support for the mature age person. When we think of other solutions that we need to look at is regularly meeting together as a sector and to try and ensure that we work collaboratively, share information and address the solution together. But we need more than the sector. We actually need to involve the real estate industry and the housing industry as well to see how we can come up with collective solutions. We also need to educate people about how to be good tenants, how young people moving into housing can ensure that they maintain their tenancy. We need to think about potentially head leasing properties for people coming out of prison so that when they come into the community sector, they are assured of a property and don't fall back into perhaps ways that get them reincarcerated. We also need to ensure that in our communities there are risk groups, and so in terms of making sure that there are women's shelters, men's shelters, youth shelters in every single one of our major regional communities. The reality is it's a multi-pronged approach we need, and it is not a quick fix. It is a long-term issue that we need to deal with it, but we need to begin now. You may remember I said at the beginning, imagine your house was destroyed in a storm. Where would you go? The one thing we know, you will struggle to find a rental property. And that storm that took your house is a storm that is coming around housing. And we need to prepare for that storm before the storm really hits us, because advice from overseas tells us we are but on the crest of the wave of a major housing problem. Thank you for listening to me tonight.
Hi, my name is Fazina. I work at the Neighbourhood Centre in the Multicultural Services under the CAMS program. CAMS program is classified as Community Action for Multicultural Society, and we look after our whole communities here, our early migrants and migrants who migrate to Harvey Bay area. Our program is equitable to access to services. This program was for response to appropriate to their needs, to the people who are migrating here and people who have lived here from our whole community, to fully participate in the benefit from all aspects in life in Queensland, and to feel sense of belonging in a cohesive and harmonious community. This program strives to ensure that the Harvey Bay multicultural community feels a sense of belonging and an opportunity to socialise, have information and access to local services, participate in community life. In our program, we are durable to plans and actions taken, community action for multicultural society, weekly activities to promote and build connectedness of individuals, group-based activities, events per month to promote culture, information session, education, awareness, and building positive relationship within the community. Individual support for DV clients and people who are not so fortunate of having access to services and fall into the gaps, getting connected with schools and early learning, addressing support for visas and citizenship applications. We have a pro bono that works alongside with this program with me, who is also a registered migration agent. Raise the awareness and understanding of the significance of Aboriginal and Torres Strait Islander languages and culture in Australian contemporary society, and to support Aboriginal and Torres Strait Islander Australians. We are looking at some of the projects, example movies and school visits to promote and celebrate richness of our First People of the nation. During COVID, we had a massive support throughout our funding body and to the Queensland government and also the Queensland Health to promote the awareness of COVID restrictions, and to also promote the awareness of different languages through the SBS websites, and where people can have a contact person if they needed to talk to someone, have an interpreter services linked on our websites at the neighbourhood centre and on our Facebook page as well, which has been very responsive, and I'm very thankful for putting all people connecting to our neighbourhood centre and asking questions and coming up face to face as well. We are back to face-to-face activities with our CAMS program. It's going really great, and we are encouraging all our Coal community people, everybody inclusive, to be part of our CAMS program and to visit our website at www.hbnc.com.au, and to also give our feedback and survey there as well. What do you think of the program that is going ahead? In all this duration of the COVID support, we had people from different backgrounds that had been in touch with us, whether from the neighbouring communities to Hervey Bay that had been in touch and asking questions of visas or in relation to that. You are still most welcome to come ahead and ask us those questions. We will be linking you to the support services that are available. We are talking to our Home Affairs Department. We've got a contact person who works for the Department of Home Affairs, who's been in touch with us in regarding to what issues we've been having here at Hervey Bay and what are we doing about that. So we would love some feedback on that. We are promoting our cultures. We're looking at the projects that's heading for next year for schools, and we've got a Cultural Diversity Matters Hervey Bay group that meets once a month, and I'm very pleased to announce that the project Making Hervey Bay Home is nearly there, it's nearly finished, and we had 30 plus migrants participating in this program, and it's going to be a showcase for it at our cultural centre early next year around March, and we are looking forward to that and all the support that the community has provided us, and we are looking forward to working with you all in conjunction for a better society. Thank you so much.
The cost of living is at the forefront of the minds of every Queensland household. Cost of living is determined as the amount of money required to cover basic expenditures such as housing, food, taxes and healthcare at a certain place and time. The cost of living and affordable housing are ranked by Queenslanders as the most important factors when choosing where they will live. Over the past 20 years, the cost of hospital and medical services has risen by almost 200%. Electricity costs have jumped 195%, and preschool and primary education costs are up 160%. The Australian Institute of Health and Welfare data shows that our region has one of the lowest uptakes of health insurance in the country, with just 52% of people insured. Through innovation and government intervention, some household staples have reduced in price, but overall wage growth has not matched cost of living pressures. The Fraser Coast has a population of 106,000, living in 48,000 dwellings. Over the past decade, Hervey Bay has been one of the fastest growing cities in Australia, which places extra growing pains on community and social infrastructure. While a naturally beautiful and safe place to live, the Fraser Coast has ingrained historical challenges, including higher than state and national unemployment, and currently every one in four of our youth looking for work remains unemployed. Our health and education standards are lower than our neighbours, and our average weekly income remains among the lowest in the state. The COVID-19 global pandemic has taken a further toll on cost of living, with large downturns in disposable income and business spending. The latest reports show cost of living in Australia remains 8% lower than the United States. In 2018, the Fraser Coast had a median house value of $304,000. That's $150,000 lower than the median house valuation for the rest of Queensland. The Fraser Coast Social Plan is dedicated to investigating ways in which we can reduce the cost of living. That includes encouraging the development of more diverse and rewarding employment, constructing cheaper housing alternatives to improve affordability, and more social housing to reduce rental vacancy pressures, which are currently amongst the highest in the state. Other suggestions have included development of a food and health hub with community gardens to help feed the vulnerable and hacker spaces to better engage and unite our youth. Job creation and growing the economy of the Fraser Coast are critical factors to success in managing the ongoing cost of living pressures. Investment by government and private enterprise in new job creating infrastructure, such as the munitions factory and train building capabilities in Maryborough, growing tourism in Hervey Bay, and ensuring our students are equipped with the changing skill sets required by our employers now and into the future, go hand in hand with success. Increasing government payments for unemployed and residents with a disability and pensioners will also assist in reducing rental stress and cost of living pressures. But no plan is complete or will be adopted by the wider community without community input. And that's why we're calling on you to get involved, to ensure your ideas, innovations and opinions are heard. Councils, community centres and well-intentioned individuals cannot change the status quo on their own. It requires united voices and collaboration to achieve change. If you want to be part of that positive change for the future of the Fraser Coast, then please make contact and help influence the implementation of the Fraser Coast Social Plan. Thank you.
The Wide Bay Burnett and the Fraser Coast for too long has been known as a challenged area, and the work that the neighbourhood centre here in Hervey Bay has done around the Fraser Coast Social Plan is really going to make a difference in the future for our region and the wider Wide Bay Burnett community. Sadly, we have members of our community here who have struggled. They've been left behind by society in some ways, and they've missed out on some of the opportunities of other communities. Personally, I think the Fraser Coast has turned a corner, and the timing of the social plan has been just ideal for the bit of a trend that's starting to happen here in the Fraser Coast around the attraction of new businesses, which hopefully will lead to more opportunities for our residents and which may hopefully spread out right across the Wide Bay Burnett. Our community has got its challenges. We're a growing community. The social plan hopefully will enable some of our members to get out there and get involved in the community a little bit more. It will also give the opportunity for new business startups, which is very, very important. The Fraser Coast has many thousands of small businesses, and we're going to continue to need those businesses to grow. Areas of interest for me are trying to get our youth engaged, and I think some of the initiatives that have been ticked off in the social plan so far have really got a long way to achieving some of those goals. It will be a work in progress, and we do need our community to get involved. You know, we don't want to give people a hand out, we want to give people a hand up, and this is a prime opportunity for more members of our community to get involved in this vital project, because our Fraser Coast region is one of the greatest regions in Australia, and we really need to work as a team to make it a better place to live. How's that?
Okay, the Fraser Coast Community Health. So how are we going? Community health is not a race that anyone wants to win in numbers, yet sadly Fraser Coast is leading the way with teenage pregnancy. While the national average with that is 12.8 per 1,000, the Fraser Coast is almost 4 times that at 46.4. Obesity rates, the Queensland percentage is 59.2% and Wide Bay 68.4%, with Fraser Coast sitting at 68.1%. Type 2 diabetes is weighing in at 4.9 people per 100. Heart, stroke and vascular conditions has state statistics at 5.79 per 100 people, and the Fraser Coast is sitting at 7.2. Mental and behavioural conditions state statistics are 9.1 per 100 people, with Fraser Coast sitting at 19.3. And state statistics for infant mortality in babies of less than 1 year is 3.6 per 100, and Fraser Coast is almost twice that at 6.1. So each point being a whole topic on their own, although the PHN reports suggest that there is an improvement in some areas, but much, much more needs to be done. The National Rural Health Alliance's January 2020 fact sheets report that in aggregate, people who live in rural areas have shorter lives and higher levels of illness and disease risk factors, more so than those in major cities. This can be explained in part because they have poorer access to goods and services and educational and employment opportunities, as well as lower levels of income. Australia-wide evidence shows that the health of rural people is poorer than that of their city counterparts. Accessing primary health, dental care, allied health and specialist services is more difficult and in many regions requires greater time and expense for travel and accommodation. The health of Indigenous people in rural and remote areas is significantly worse. The viability of many rural hospitals is uncertain, and there has been serious loss of capacity for maternity services and other procedural care in rural areas. Infrastructure in rural and remote areas for health services and health-related activity is limited and being further eroded by a lack of ongoing investment. Shortages of health professionals, including doctors, allied health professionals, pharmacists and dentists, are becoming more pronounced with remoteness, and it is difficult to attract and retain those health professionals in rural and remote areas, particularly those who study and train in our more metropolitan areas. Now, it doesn't sound inspiring, and quite frankly, the statistics are depressing. However, there is change happening. The Fraser Coast community is coming together and developing programs to either ease the climb of the numbers or to support those after the fact, such as Harvey Bay Hospital's Cuddle Cot initiative. Now, the Cuddle Cots are special cold units that are created in a basket in a box type environment, which helps preserve the body so that parents can place their stillborn child in that box and take them home and spend time with them and go through that grieving process for as long as they need. It's important that it does support that grieving process. Another example of community is Maryborough State High School's vision to move forward and develop a new student enrichment precinct, enabling all students the opportunity of an education with breakout zones for mental health care. Now, this project is on target to be completed by the 14th of January 2021. Maryborough State High School has also worked towards addressing the medical professional retention rate by negotiating and securing education agreements with Central Queensland University. CQU will be the RTO in partnership with the school to enable health career focused curriculum that comes into effect next year, 2021. Students in Year 11 may undertake Certificate 2 and Certificate 3 health services, moving forward to a diploma in medical services in their Year 12 years. The educational agreement leads then direct into a Bachelor of Medical Science at CQU. By the time the Bundaberg Level 5 hospital is complete in 2025, these students will move forward into a post-grad in medicine, all while never leaving this region. The program will save students thousands of dollars by enabling them to complete their degrees 2 years earlier, and currently there are 26 students ready to start next year. The precedence has now been set to encourage and advocate for other educational institutions to commence discussions with universities to address skill shortages and to enhance educational and employment opportunities in the region, which sets a pathway to improve the community health statistics. The initiative also fits across a number of other themes. The social plan will hopefully help retain it and will also help keep younger people in the region. So there's still a long way to go, but the future is looking bright. We are in this together, building a Fraser Coast we can all be proud of and a Fraser Coast that others want to be part of.
An ageing community. The Fraser Coast population is represented by a higher percentage of people aged 50 years plus, and this sat around 47% of the population in 2016 and is forecasted to grow to at least 49% by the year 2041. We are living longer, and the local area has a very high representation of people aged 85 years plus, including those who are reaching 100 years and over. This age group is expected to double in that time frame from 2.9 to 4.1%. So, yes, the Fraser Coast is an ageing community, and we need to identify and address the pros and cons of an ageing community and plan for the changes required to meet the needs of these people. Taking into account the differing outlooks, their achievements and expectations of the various age groups within the range of ages. We also have a large number of senior residents in the Fraser Coast who have migrated here from other states. And with that, they've also left behind them families and friends. So isolation can become a big issue for them, especially if one of the other partners is lost out of the situation for whatever reason. If they haven't already created these important community connections, then it is much, much harder for them to do this when a loss is experienced. Social isolation then becomes a major issue, and so does dealing with the simple things such as completing paperwork, dealing with medical issues, and seeking assistance in other areas of everyday life. Grief is also a major concern for many, and this is not only includes the passing of a loved one, but also making the hard decisions when one of the partners or both need to enter into care. The partner is lost in another way, bringing with it other responsibilities and sometimes guilt. They are grieving a loss of independence, and this can sometimes be the hardest thing to deal with. We add to all of this the pandemic, and isolation becomes an issue for us all. For seniors though, it is harder, as they are vulnerable and less likely to be utilising technology to stay connected with family and friends. We have phones, you say, and yes, these are important ways of staying connected, but it's only audible. And contact needs to be, on occasions, visible and physical. Who throughout this pandemic has been missing a cuddle or some kind of human touch? Identified under the current social plan are 4 different major themes. One is promoting and supporting active ageing within the community, recognising and utilising the skills and talents of older members of the community, promoting ageing in place, and social isolation. How do we address this? There's been a number of projects that have been identified as possibilities of addressing some of these issues, and they include the creation of a website where local organisations can access to promote their programs and activities, and the general public, in particular seniors, can access as well to find out what's going on around town. We're already aware that there are a number of other sources trying to do this, so the hope is to bring all those sources together and make a united front with one contact for everyone. Access to the internet is another project, and the group are looking at ways of raising funds or gaining funding to create projects where isolated seniors and seniors in general can learn about using tablets and the internet, and in particular your social connection programs that have all become prevalent throughout the pandemic. A skills exchange is the third project, where we're hoping to encourage local organisations to promote skill exchange workshops, programs, and on occasions this is hoped that this will be intergenerational, where the young are learning from the old and the old are learning from the young. A buddy system is our fourth project. This is a system that was trialled a number of years ago and was very successful. but due to funding, it ceased and fell apart because the volunteers required some support. So the idea is to bring together a volunteer buddy with an individual who can then support them to make that first and initial important contact with organisations and activities, and then support them until they're integrated into that group. They can also help them with their transport and other linkages in order to keep them involved. The last thing is looking at IT and scams, creating some workshops that increase the knowledge, experience and awareness of our seniors so that they too can stay connected. Where to from here? Continued conversation to identify stakeholders and community partnerships, sourcing funding opportunities, identify what strategies may be implemented, and continue to identify the challenges that face us every day and to address these through this reference group. Thank you.
Hi all, I'm Adam, and one of the themes that I'm talking about today is the livability on the Fraser Coast. I work with Fraser Coast Council, but I'm also involved in the Youth Alliance as well, so you've probably seen my face twice through the presentations tonight. We're starting to see some more projects starting up again in the community following the hiatus due to COVID-19 restrictions. Council are continuing their efforts and working with the community to develop community plans in our small communities. Community planning is an important mechanism for identifying and understanding community aspirations, priorities and is a process that is designed to enact and empower that community to carry ownership for the development and improvement of their communities. The ownership of the community plan sits with the people of the community. It's not the responsibility of any one designated person, organisation or level of government. Community consultative groups have worked to outline and identify the vision of the community, key community objectives, priority projects and actions, primary stakeholders and a vision for the implementation of short, medium and long-term priorities. Community planning process provides a whole of community approach in terms of the community's plans, foundation and the identification and prioritisation of specific key projects. Council is currently working on community plans for Glenwood and Tyra in the south, Burrum Heads in the north, and Poona is just about to be completed with the plan to be presented at Council's November meeting. As a region with diverse communities, the community engagement approach has differed throughout each of these communities. The engagement principles for each plan, however, has been based on a participatory approach, engaging with the whole of community various times throughout the planning process. These individual community plans are important in understanding the needs of the specific communities, whilst the social plan provides a board for the regional need. The community's plans can undertake a deeper dive into a local community level. The community planning process is undertaken in line with Council's corporate plan that identifies the goals of Council as a result of consultation with the community and staff and the representatives of the overarching vision that is shared by the Fraser Coast region. Theme 2 of the plan identifies lifestyle. A safe, vibrant community that promotes itself as a preferred place to live as a core component in enhancing our region's lifestyle and economy. Further community planning in other small communities will be identified under the Council corporate plan moving into next year. In reference to actions included with Theme 1 that relate to the parks and open spaces under Council's Community and Development section. These actions are to be discussed with the responsible teams for the consideration in future planning. So from terms of the social plan, there was certainly work on the livability, but we're starting with our small communities first, finding out what they really need, and then moving into our parks and open spaces from there. Thank you. Hello and welcome back again. I'm Adam, and this time I'm wearing a different hat. I'm part of the Fraser Coast Youth Alliance, which is a conglomerate of all the youth services, council, police, PCYC, Reconnect Youth Centre, etc., Red Cross, that all provide social services to the youth sector. something that people may not be aware of going into the social plan and having a deep dive into what's going on the Fraser Coast, that based on the 2016 census, that 18.8% of our 15 to 24-year-old residents what the car says disengaged. So disengaged is not attending school, not getting any education at any time, or not doing any work either. That's a pretty astonishing statistic, seeing as the rest of Queensland's only at 11.5%. So the primary focus of the social plan moving forward is to work on disengaged youth. How do we get our youth engaged? How do we get them interested in planning in the future, being part of our community, and making a life for themselves on the Fraser Coast? Something that also stood out when I was having a look at the having a deep dive into the stats of the Fraser Coast is that 32.7% of our residents here on the Fraser Coast have only achieved Year 12 level of education, whereas the rest of Queensland is 50.5% plus. So again, a lot of our kids disengaged, not staying in education for the long term. So when we were working on the social plan, would have gone back to November last year, we highlighted some initiatives to see what we could do to help re-engage our youth and get them provided with services. The first thing that we came across before we go ahead is that disengaged means not going to school, not contributing to services, not working either. So these people are floating around in our town, in society, where a lot of our youth crime comes from, because the kids are just simply bored. They're not looking towards the future. They're looking for stuff to do, and often that'll lead to trouble. One of the first initiatives that came out of the social plan was the youth street team, temporarily in a hiatus due to COVID restrictions. But this is a team of combined social services that are actually supplying services of an evening to our disengaged youth. They started out by working on Thursdays, because Thursdays apparently is one of the bigger nights for having youth out and about. And they're just there to highlight services and engage with the kids that are out on the street, and to find out what's going on, other services they can be connected with, provide a little bit of crime prevention, and they often will have a bit of food and tucker on board, so they can just help the kids out and start knowing that people are looking out for them. Some of the connections that we've been working with that are providing a safe place for the youth through the Bite the Blue initiative is the Reconnect Youth Centre, Espresso 331 Cafe, the Wandering Teapot here at the Neighbourhood Centre, Barra Republic, Kerry Campbell Homes and Positive Outcomes over in Tully Street in Maryborough as well. They're all opening their doors and providing a safe space for people that are feeling unwell, that are not feeling the best in their headspace and just need somebody to talk to. So there's some private enterprise that are getting on board and supporting a lot of our youth initiatives as well. Another initiative that came through was a Little Blue Book. So this is something that I've been personally involved in, and this is a straight up guide to help our youth's mental health, to keep them on track and keep them engaged, and how to find out, if they are facing mental health issues, or if they've got friends that are facing mental health issues, how they can find help, and getting people pointing in the right direction to re-engage and connect with services as well, help them out with their headspace. Some other initiatives that have been included that are out on the Fraser Coast at the moment is that there's the new youth care accommodation that's working with homeless youth. So there's been a brand new facility built on Taylor Street since the start of the social plan that has 4 units that are available for homeless youth to help them transition into private accommodation. The Bay's Biggest Sleep Out, another initiative from the social plan. This is a fundraiser to raise money for our youth services, where they had business people around the Fraser Coast sleeping out, taking part in auctions and raising money for our homeless youth as well. The Community Navigator program is another initiative from the Harvey Bay Neighbourhood Centre that basically runs with the Reconnect Youth Centre, because sometimes as a young person, the challenges they'll face is not knowing where to go to find what services they need. So the idea of the Navigator program is that they can open the one door and point the one client in the right direction and set their path in a correct and accurate manner. And there's a few other initiatives that are in the pipe work at the moment, but they haven't been finalised yet. So there are lots of things that are going on to help our disengaged youth here on the Fraser Coast. And I look forward to talking about some more initiatives as we go through the future and the next update in the social plan. Thank you.
Hi everyone, my name's Kirsty and I'm talking to you tonight about the families and children theme for the social plan. One of the most galvanising pieces of information that has led us to put this together is around the Australian Early Childhood Index. And what it shows is that the majority of our 5-year-olds in the Fraser Coast region are not developmentally ready to take their place in school. So let's have a look at what we've done. What we looked at were the strategies that we needed to, or that we felt were good to be able to improve the outcome of these children. We looked at, first of all, the fact that we needed some education for parents that improve their coping skills, their parenting skills, and their ability to bring their children along and make them ready for school. We looked at some early intervention and prevention strategies for families that need specific support. And we looked at providing cultural knowledge and awareness for Indigenous children who are in foster care. Some of our achievements to date include the fact that across our region we currently have 49 playgroups. This is a great achievement, and there are a lot of children who are in these playgroups who are actually learning and becoming more and more ready for school. However, we need to increase this, and we need to make sure that we run a range of diverse, culturally diverse and educationally diverse playgroups across our region. We have our First 5 Forever program that comes out to us through the Fraser Coast Libraries. And this is a program which encourages parents to be the first educator of their children and to work with them, particularly around literacy. We looked at early intervention, and there are a range of services across the region that provide early intervention activities for families who need them. What we need to do is to be able to pull those services together to make sure that people know exactly where to go and where to find what they need. We also have a wonderful perinatal health checking system, and that's run by the Department of Health. But again, that needs to be more greatly used than it currently is. So what are the opportunities that exist for us around this families and children theme? In relation to education, we might look at possible weekend playgroups. This would enable mums and dads to be able to come out and to be able to learn how to actively play with their children. And this is a little bit difficult for some of us. It's not easy to sit down and pretend that you are at a child's tea party, but these are the sorts of things that we need to do and actively encourage our parents to do. We could have some welcome baby celebrations where we as a community bring all of the families in. We can connect with each other, we can talk with each other, and we can actually welcome all of the babies that are born in our region and introduce them to our region. We can look at some adopted grandparent activities. These again enable older people in our community, and we have a lot of people in the Fraser Coast region that are in that demographic, and it allows them to come in and to interact with younger people. It's a very positive activity for the older generation because often they're not seeing their own grandchildren who don't necessarily live in this region. But it's also a wonderful opportunity for our younger people to learn from the older people in our community. In relation to early intervention, there are a number of things that we can do. One of them is around implementing a doula program. And this is where we provide a person, a trained person, who can walk with the pregnant and then parenting families to help them as they try to overcome a range of different challenges that face a young family when they start out. We can look at outreach services that we can provide to young parents, and we have a number of models that we can go to across the country that give us a really good idea about how we might be able to put these together, and then we can work with our young people to make sure that what we're planning to do is something that suits them. We can look at integrating some early childhood educators with the current family support workers, and there have been a couple of programs across the country that have shown that this has had very positive results. And we can implement the first 1000 project across our community. And this is a project that concentrates on the first 5 years of a child's life and making sure that they pick up the things that they need to know and understand to take their place in the education sector. We can look at implementing the Brave Community Champions. and they will support expectant parents and families. And this again is a model that has been introduced in other places, that has shown some success, and that we might tailor to be able to fit our community. And we certainly would look at reviewing the current perinatal health check and making sure that it provides all the opportunities that it needs to for our young people and our young families. In relation to the cultural knowledge for Indigenous children, we really need to start at the grassroots here. This is something that we don't have, and this is something that we need to connect with the community around. We need to listen to them, we need to understand their views and what they want to happen, and then we need to be able to cultivate the networks and the relationships across our region that would enable us to introduce something. And what we also need to do is have some action research around this. So when you're implementing a new program, it's generally not going to work perfectly the very first time. So we need to make sure that we're planning, we're implementing, but then we're evaluating and working with the community to make sure that we know that what we're doing is working before we then adapt our plan and move forward. So as you can see, there are a range of different things that we can do that will help the outcome for our children and families. And I look forward to talking to you in the future about the successes that we've had from that. Thanks.